Hi, my name is Dr. Matthew Oetgen, and I'm the Chief of Orthopedic Surgery and Sports Medicine at Children's National Hospital here in Washington, D.C. Here today to introduce you to our exciting new venture, our Fight for Children's Sports Medicine Center that we've just opened up in Silver Spring, Maryland. There's been a lot of questions about it, and so we thought that we would answer some questions, get some information out there, and hopefully introduce this new exciting center to everyone who's interested in it. So hopefully we'll get to the first question and start to see what we have. So the first question we have is, what is the Fight for Children's Sports Medicine Center? So the Fight for Children's Sports Medicine Center is a brand new Children's National facility which has been developed in partnership with Fight for Children's here in Washington, D.C. It's located in Silver Spring, Maryland, and it's a facility that really we're going to use as the hub of our sports medicine care for the children of the greater Washington, D.C. area. It's really a first in its kind and only in its kind state-of-the-art facility, which is focused on pediatric and adolescent sports medicine. It's really, like I said, going to be the hub of activity directed at the care of young athletes, broken up into three different distinct areas. The first is our clinical area where we will treat and see patients associated with sports medicine. The second is a pediatric and adolescent directed sports rehabilitation gym. And then the third is a very unique performance laboratory where we're going to use state-of-the-art motion analysis to see if we can pinpoint areas that we can work on for children to make them better athletes, avoid injuries, and enjoy sports even more as we move forward. Let's move on to question number 2. What is unique about the Fight for Children Sports Medicine Center? Well, I think that the most unique thing that we have there is the mission that we've set up for this center. It's really concentrated in these three areas, and it's sort of a threefold mission. The first is treatment of injuries for pediatric and adolescent patients. As most of us know, kids have unique injuries. Their growth has to be accounted for. They don't get injured the same way as adults do. And so it really takes a unique sort of perspective to treat, diagnose, and ensure that kids get the proper treatment. Their rehab requirements are a bit different, and their healing potential is different as well. Our center, our Fight for Children Sports Medicine Center, is really dedicated to injuries in pediatrics and adolescent sports medicine. And they're treated by professionals who have a deep understanding of the health, the growth, the healing of children, pediatrics, adolescent sports athletes. So I think that injury treatment is our first mission, and it's really unique here all throughout Children's, but certainly at the Sports Medicine Center. The second area that we really focus on is injury prevention and rehabilitation of the adolescent and pediatric population. We have a pediatric trained therapist and strength and conditioning coaches who really will work one-on-one with athletes to overcome injuries, prevent injuries going forward, and we'll do this in a really one-on-one fashion, which is fairly unique in the therapy world. Additionally, because the clinical area and the therapy area are housed under the same roof, we're really going to have and do have a lot of one-on-one cross-interaction between treating physicians and treating therapists to facilitate communication and improve outcomes by sort of joint assessment of potential and rehab goals. Our final area and final mission that makes this unique is our performance enhancement lab. And this is really a one-of-a-kind here in the greater Washington, D.C. area. It's an area with state-of-the-art three-dimensional motion analysis capabilities that we will use to capture and analyze athletes' motion to allow targeted rehab and performance enhancement programs to be developed to improve performance, strengthen areas which may be weak, that may predispose to injury in a very targeted way that we can measure before and after how therapy and how the rehab programs are affecting and working for the child. So it's an exciting new technology that we're bringing to the area that really is going to allow for more precise, more guided, and more results-oriented rehab and performance enhancement, so we can get kids back on the field quicker, keep kids on the field quicker, and allow them to play to really their highest potential that they can get to as they move through the ranks of adolescent athletics. Let's move on to the next question. Where is the Fight for Children Sports Medicine Center located? So we are located on the first floor at 1 Inventa Place in Silver Spring, Maryland. It's really in the central part of Silver Spring. It's a very exciting location with lots of activity going on. It's a beautiful space with all of these areas of clinical and rehab medicine housed under one roof. There is on-site parking as well as access to the metro directly across the street. So it's a very nice center, and I think it will be easy to access as well. All right, question number 4. Who can make an appointment? Well, the answer to that is anyone. We treat kids up to and through college, and so we are welcome to new patients, second opinions, and referrals. The way to make an appointment is to call the appointment line, and that number is 301-576-2000. 301-576-2000. That's our direct number to the Fight for Children Sports Medicine Center, and we can certainly accommodate any appointment for any pediatric or adolescent or young adult sports athlete that needs to be seen. Number 5. What's next for the center? Well, currently the center is open for business, and we are seeing patients 5 days a week. Like I said at the beginning, this is broken up into three different areas. One is our clinical area where we treat and see patients, and that currently is open, and we are seeing patients right now. The next addition to the center will be our physical therapy and rehabilitation gym, and that is scheduled to open at the end of the summer this year, and so that will soon be open for appointments to come about at the end of the summer. And then our last piece that we will introduce is the Performance Enhancement Lab, and that is targeted to be open at the end of 2021, so winter of 2021. So more information will be coming about exact dates, but that's the next few months what holds for our Fight for Children Sports Medicine Center. So thank you very much. I appreciate your interest in the Fight for Children Sports Medicine Center. We're very excited. We think it's a unique experience which will really provide better care, better injury treatment, injury prevention, and performance improvement for the pediatric and adolescent athlete who live in and around the Washington, D.C. area, to help us provide better care for our hometown patient population. Thank you very much.